So why airway, the airway approach over the traditional pediatric dentistry?
Well, that's a great question because I think a lot of people think of dentistry as just very tooth related. And unfortunately, it's also become very symptom based. So if you have a cavity, you figure out who you're going to find to fill the cavity as opposed to really going into ultimate and personalized prevention.
Like, how did that cavity get there?
How'd that cavity get there? Because even though cavities are still and worldwide, the number one chronic disease of childhood. Isn't that amazing?
That is amazing.
Yeah. HWO actually just recently, I think 2 years ago, put that it's still there, but it's the most common preventable disease of
Hmm.
childhood. So cavities or caries are not, they're not inevitable. So if you take that a step further and start looking at like the holistic way our body is put
Like taking a
together,
step back,
taking a step back,
because the normal thing is a cavity shows up,
you fix the
you
cavity.
fill it, and then you
Right.
move on and hope you don't get another one.
That's right, and you go to checkups to, find out what's wrong with you, basically, as opposed to learning how to take care of yourself. And, a problem I think that is sort of intersected with medicine and people in general is that, and I I don't exclude myself out of this, but because medicine is so advanced, in a lot of ways, it's easier to take a pill than it is to make lifestyle changes. So, in order to be cavity free, for instance, you have to make lifestyle choices and changes. And that's very hard with the food system and, the messaging that we're all getting, but it's possible. So, if you take that even bigger, and think about that the teeth don't exist in space. They actually exist in jaw bones, which is the upper maxilla
Mhm.
and the lower mandible. And the maxilla holds the upper teeth, but what people don't realize is the maxilla and the mandible, which holds the bottom teeth, are actually form the bony borders of an airway. Okay.
The bony borders of an airway.
Right.
Say that 5 times
Okay,
fast.
right. The bony borders of an airway. So we know we have this is how we can get air into our body. We can get it in through our nose, right? Or our mouth. But we're really supposed to be breathing through our nose at least 90% of the day.
Mhm.
Okay. And that is super important because only when you're breathing air through your nose are you filtering it, warming it, and preparing it to hit your lungs. Okay.
Okay.
We also have sinuses that release chemicals or enzymes that help purify that air and are actually a natural antiviral. Okay. You don't get that by breathing through your mouth.
So mouth breathing is not the best way.
It is not. And if you look around,
We
so
probably heard that, but I
yeah.
mean, but I
Well,
never heard that explanation of the sort of purifying and
well, we were meant
the
to have a
processing.
nose, right? We have a nose for that reason. Our nose is the filter from the outside to the inside, if you think about it. We can breathe through our mouth, but that's not how we're supposed to breathe.
Mhm.
Okay. So if you know that your nose is your primary filter, okay, and you also know, here's another little fact that the bottom bone of your nose is the same bone as the top of your mouth, the palate.
Okay.
Okay. So that's part of the maxilla. Now, if you have crooked teeth, instead of saying, why are my child's teeth not fitting or why are they crooked? Instead of saying, let's take out the teeth to make them fit together. If you look at how the body mechanics are supposed to be, why is that crowded? It's crowded because your maxilla, your upper jaw, is too small. And what are the implications of that? Well, a smaller maxilla, upper jawbone, is a smaller nasal cavity. And simple question, if you wanted to breathe through something that was like a little stirring straw or something that's like a garden hose, what would you
The
choose?
garden hose, of
A garden
course.
hose, right. So then if you take that a step further, we forget about how important our tongue is. Okay, I'm using my tongue right now to talk. And that leads to, how many kids or parents have their kids in speech therapy. Okay, we'll get to that in a minute. But our tongue, while we're awake and asleep, should really be fitting in the roof of our mouth, our palate.
Mhm.
So we have to have room for our tongue to fit. So we have to start looking at making the shape of the oral cavity big enough so you have a healthy nasal cavity and room to park your tongue. Because when you don't have room to park your tongue and you go to sleep and you don't have gravity in your favor, that tongue, because it can't fit in its parking space, I like to say, will fall back into your throat.
Mm.
Okay. And that can cause some snoring, leading to sleep apnea. The other thing,
I think you're describing my night of sleep, by the
well,
way.
I'm describing,
A
unfortunately, I'm
lot of people.
describing, so sleep apnea, obstructive sleep apnea is a modern day disease.
Mm.
It didn't exist.
Wow.
Well, think about it. And that's what goes back to me talking about taking a pill or getting a breathing machine, a CPAP. We fortunately have so many advances in medicine that allow us to stay alive. Okay. But it's the difference between lifespan, okay, like how long we're going to live, and health span, meaning at what point in your life trajectory are you starting to need all these medications? How healthy are you during that lifespan? That's your health span. Okay. So sleep apnea, and you can't listen to a radio program, you can't watch TV, you can't without hearing something about snoring or sleep apnea. But that is an end stage disease. And it starts with, so every adult that has some sort of sleep disturbance or sleep apnea was once a child that had very small, underdeveloped jaws, no room for their tongue, and had very early symptoms, with the earliest being mouth breathing and probably snoring
Mm.
and some restless sleep. So you don't just turn 40 one day and have sleep apnea. It's been a progressive, and you want to get it while basically the structures, your airway structures, are forming.
Mm.
Okay. And ideally, that is before 6 years old.
Hmm. Now let's get back to the cavity
Yeah.
analogy or reality of that. So we have the traditional way, to
Right.
fill it. The air pathway approach, how would that look?
Okay. So that's a great question. So let's see, I've been a dentist for, oh gosh, I'm 24 years now, and a pediatric dentist for 22. Okay. And in my career, and I was guilty of this too, I would treat kids that have cavities for obvious reasons, right? Home care, diet, terrible. But I also ran into patients that said, parents were like, I don't understand. We do everything right. We're eating well. Are we perfect? No. But, every night we're brushing and flossing together and trying to keep a low sugar diet. And they're not eating soda and juice in between meals. What's happening? You know what's happening? Breathing through your mouth.
No kidding.
Yeah. It dries your mouth out. So saliva is like the protective juice that we have. That's the first step. So whenever we eat anything, our teeth are going to go into a danger zone. Our mouth becomes acidic, but our saliva within 15 to 20 minutes helps neutralize that and stops the breakdown of teeth, of enamel. But if you're breathing through your mouth, you're drying your mouth out completely, meaning all the plaque and carbohydrates is getting stuck onto your teeth, and you're sort of like air baking it. Okay. So people who usually have sleep issues also wake up with a dry mouth because they've been breathing through their mouth all night.
Yeah.
And then they're breathing through their mouth all day. So they're not getting that protective juice around the teeth that we call saliva. And again, so that's another way of looking at it. Like, we know the basics of not getting cavities, right? Brush, floss, don't eat
Well,
a
we're
lot of
told all the
sugar,
time. Yeah.
right? Okay. But who are the other people? And I'm sure you've known them, talking to your sister, or your sister would agree, that just don't understand why they're getting cavities.
Yeah. They're doing everything right.
They're doing everything
They're even
right.
flossing.
Right. Right. So really
Using
what
the
this
toothpick.
is a better approach than airway is function. Like, I even like the people are starting to relate and hear airway dentistry, but dentists are not responsible for curing the whole airway. We're an important spoke in it. And pediatric dentists, or dentists that work with very young kids, and I wish more orthodontists would do it, who start to get a kid's jaw structure. So I think I said, so the maxilla, the upper arch, makes the basically the volume of our nose. And then depending on where our upper jaw is positioned, our lower jaw is going to be positioned. So this is not my quote, it's from one of my mentors, but that the upper jaw, the maxilla, is the criminal, and the mandibles is the victim. Okay. So our airway, we know where our airway is, our throat, right back here. So depending on where these jaws are, in space, if they're really back, like if you have a retruded mandible, right, where you may look like you have buck teeth, okay, but your mandible's really pushed too far back. That is making your little breathing tube,
Mhm.
your posterior airway, your posterior pharynx smaller.
Mhm.
You bring that forward, you're making it bigger. So a lot of sleep devices that adults use, which are can be life saving and life changing, which are like something called the mandibular advancing appliance that helps bring your jaw forward. These are the same thing as those boil and bites that we, hear advertised all the time. They're bringing your jaw forward. But what if in the earliest years of growth, we could figure out why we're not growing the way we're supposed to be optimally and help that child grow into that position?
Mm.
Not going to say that it's going to cure everything. I don't know, but it's sure going to make it better.
So this came to you not as a dentist, but as a mother.
As a mom.
So it was a drastic change. I mean, anyone who knows your family and knows the history of your family knows that it is traditional dentistry that has gone back generations.
Mhm,
And you started in that path and
mhm,
many, many years on
mhm.
that, traditional path. And then
Yeah,
all of a sudden this pretty dramatic break,
shift.
that shift from that. So tell me how that began.
Yeah, it really did come from being a mother. So, I mean, in my pediatric dental career, in order to be a board certified pediatric dentist, there's certain guidelines and rules we have to follow. But what's interesting is if you look at the definition of what a pediatric dentist is, they're the ones that they're supposed to manage the growth and development of the child's oral facial cavity. Okay. So just put that aside for a minute.
Mhm.
So here I am doing my dentistry, loved it, love working with kids in this way, love getting kids through difficult, procedures to the other side. At the same time, I have my two other children who at this time are, oh, I think, let's see, my son, I think, was 9 and my daughter was probably 7-ish. And ever since my son was born, and let me just get to the end, they're healthy, thriving kids now. But ever since my son was born, um, his health was such a huge part of our family dynamic. And it actually all started because I couldn't breastfeed correctly because he had a tongue tie. But I didn't know this. I was actually in my residency. Okay. But that led to 3 years of, doing GI studies, doing all these extra things. Having his tonsils and adenoids out at 3,
Oh
and I
my.
and I didn't even know why at that time. It's just we were in and out of the hospital so much that, um, it was just like, "This is what's gonna happen." Okay. And then, he sweetest boy in the world, but, he was really spacey, sorta hyperactive, not the normal hyperactive, but I remember when he went to camp once, he came back and he said, "Oh, my counts are so funny." He calls me Earth the Jack. But what he was hearing is somebody was saying, "Earth to Jack, where are you?" Right? And a similar story for my daughter. So, as dentists, we go to continuing education all the time, as we should. So, I think it was 2016, um, at a huge dental conference in Boston called the Yankee Dental Conference. I went to a lecture that was about early orthodontic treatment in airway.
Mhm.
And I was like, that's interesting.
That's
I want to do
interesting.
something new. Right.
Mhm.
And the interesting thing is my father, Lewis, was signed up to go with me, but he realized he double signed up for something. So he said, I'll go to that other class. Well, that lecture was 3 hours and it started with um, them presenting pictures of kids' faces, no teeth yet, just pictures of kids' faces, and then reading either a report from a pediatrician or a therapist or a school or a parent about what was going on with that kid, right? Speech issues, oppositional defiance, not sleeping, won't go to bed, picky eating, all these things as parents that we are going through, get sick all the time, can't lick it. There's something that all of us with parent as who have children who thankfully have within normal limits of health, but there's these little bugging things that we've gotten so used to that are common but not normal. And when this doctor then put it all together about how it all goes with basically how well we're breathing and sleeping,
Mm.
and the impact that dentists can have as part of that puzzle, because especially dentists that work with kids young when they're growing, to change the structure, you can start to change basically the quality of life for the child and for the family who's raising this child. And it hit me like a lightning bolt because almost everything they were talking about was in some way related to what I was going through with my own children. And I just couldn't put my finger on it. If I've learned one thing, it is to always, always, always listen to parental, and no offense, John, maternal instincts.
Mm.
Moms, no. And moms sometimes just don't hear the answer that makes sense to them. So they keep looking and they keep searching to find an answer. And it it became, I don't know, it was a breakthrough moment. At times it felt like a breakdown moment, but it was a breakthrough moment to the point where I ran out of that class and I found my father, my uncle, my husband is also a dentist, and I said, everything's changing. Like I can't do things the way I normally do anymore. They're like, what are you talking about? But just seeing it from a totally different
Lauren, what are
lens.
you saying?
Yeah. Oh, yeah.
I'm sure.
And
Yeah.
it's one of those things that once you see it, you can't unsee it. And then once you start to see the changes it's making in your life with your own children, and then you start treating some more children and some more children with this type of approach, and hearing the stories that you're hearing back about the quality of life that's improving. Um, they're sleeping again. They're not as hyperactive because the symptoms of ADHD and ADD almost almost completely mimic the symptoms of restless or poor sleep in a child. I'm not saying that dentistry cures ADHD, and I'm not saying it's not there, but I'm saying if your body isn't working functionally, if you're not sleeping the amount of time in a restful, deep sleep, getting into all your sleep stages as a child, when you need that more than ever, I mean, you are at the highest amount of brain growth. You need deep restorative sleep. You need to get into those deep levels of sleep. And if you don't, you are not at your best, period. We're like that too. But kids are really chronically sleep deprived. There's lots of reasons. It can be, they're up too late on a tablet, blah, blah, blah. But there are kids that go to bed at a certain amount of time, sleep the recommended hours, and wake up. And they wake up tired, and they're tired during the day. And I mean, think about a child. When you have children, when they are at their worst and you say, "Are you tired?" What do they say?
No.
"No, absolutely not." Right? Even when you know that they're
Not a
tired.
chance.
"Nope, nope, not tired." And that's when you know that they're overtired. So, adults, we have the benefit of drinking coffee, right? We have been living with restless sleep and non-restorative sleep for a long time. We may describe it as sleepy. Kids have a paradoxical reaction where they're actually hyper. They're hyper because they don't want to miss a minute. They don't want to say they're sleepy, right? And the way it was described to me once is, if you're driving a car and you're sort of falling asleep, what do? You roll down the window, you start tapping on stuff, you start doing things and moving to keep yourself awake.
Yeah.
And that's sort of the same thing that you can think about with a kid,
Mhm.
but they're sleep deprived. So again, I think some of the questions we should be asking is why. So whether it's dentistry or medicine, why? Why is this happening? We still might have to treat the symptom, but maybe we have to treat it differently or less or for a less amount of time if we understand why, right? So those are the questions. I even think kids that are having trouble in school concentrating, they should have a sleep screening. I'm not saying that they shouldn't be put on medication, but we should find out what's going on.
It'd be nice to do everything possible before
Yes,
putting them on
ruling it out.
medication. And
Right.
this is one of the fundamental questions in all of healthcare, Western medicine,
Medicine. Yep.
which you look at this, and I was even hearing something, and I don't know if this is true, but the idea of taking out the wisdom teeth and the wisdom teeth are like connected to the pineal gland
Oh,
and
yeah.
all this. But that's a whole other story. Feel free to
No, but I
comment
mean,
on it. But
well, I mean, it makes sense. So going back to the fact that our jaws are the keystone bone
Mhm.
of our cranium, okay? And what's in our cranium? Our brain, our eyes, our nose, our filter, our pineal gland. Um, very important things. Our whole nervous system, basically our parasympathetic, that's your relax, rest, digest, relax. That's sort of the buzzword, like let's calm down our vagus system, like let's get zen. That's because all of us are like in a sympathetic life where we're go, 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 anxious. Our body doesn't know the difference between running from a bear or being so overburdened at work or whatever. It doesn't know. It's still going to react in that same way: flight, fright, freeze, fawn, right? So our nervous system comes out of our cranium, and we have hard tissue, which is bone, right? And soft tissue, which is, muscle, fascia, everything else. If you have sort of a network of cables, right, coming out, do you want them to be in an appropriate size hole or squeezed? Right? As we're talking about this. So, like, if two big parts of the puzzle, which are your upper and lower jaws, are too small, and we can get into why they're too small if you want, are too small, every bone that they're sort of coming together with as a puzzle is also a little too small. So it means everything in there is functioning. Otherwise, you wouldn't make it. But is it functioning as optimally as it could? And the answer is no. So when you approach growth and development, I don't even like to use the word early orthodontics as much, because when I use the word orthodontics, to me, it's still very tooth related.
it's all tooth. Yeah.
Yeah,
Yeah.
okay,
Yeah.
but it really
Bigger
shouldn't
than
be,
that. Yeah.
right? It really shouldn't be. So let's just use the word airway orthodontics, sort of with substituting it for what I like to call like arch development, facial development, where we're getting the structures bigger. We're getting them bigger for our tongue. We're making room for all the teeth to come in. Early treatment, they might not come in perfectly straight, but we've made a slot for them.
Mhm. I
Okay.
mean, would you prefer for kids not to have their wisdom teeth
Okay. So wisdom teeth is going way
removed?
back, right? I mean, we should have 32 teeth. Okay. But over, sort of like our pinky toe, we're needing them less and less. But really, we don't have room for our wisdom teeth because over the past 500 years, between the Industrial Revolution and the Agricultural Revolutions, a lot of things have changed. And I can try to simplify it with, for one, um, we're chewing and eating much softer foods, right? We give kids baby food, right? There wasn't baby food forever. The way babies ate was, the parents would chew some of it up, give it to their child, and you would breastfeed for about 3 years.
Mhm.
Okay. Well, I mean, starting in the mid 20th century, breastfeeding was like really passe,
Mhm.
right? And that kind of comes and goes. So formula was a variable difference. And when you're drinking out of a bottle instead of breastfeeding, that affects jaw development. It just does. It's a function, form and function type
Mhm.
of thing. Um, so not eating hard foods, not being in strollers more. I mean, our jaw bones have to, we all hear that you need load bearing exercise for your bones, right? To keep them strong. Well, our jaws are no different. And if we're just eating mush and eating things out of like, those squeeze bags, we are not using our jaws. And what happens, like, to people who don't, let's just say, God forbid, you have an accident where you can't use your legs, you start to wither away
Mhm.
because you're not putting load bearing weight on it. Your jaws are the same. So it can start in utero when, if you have a tongue tie, for example, like your tongue isn't is functional, your tongue should really go all the way up and use the entire upper palate to make contact with before you swallow. And that in utero starts forming the jaws. Okay. But if you have a tongue tie, you have it while you're developing. So if fetus starts swallowing, practicing swallowing at 20 weeks, which it does, and there's a restriction there, you're gonna be born smaller. You have to make up for that.
Mhm.
And there's a lot of theories of why tongue ties are more prevalent, but these have been, if you look way back in ancient literature, they've always been there, right? But I think that because moms had to breastfeed longer and get that function, we could help them grow out of it a little bit more.
Mm.
Okay.
And right now, again, that's that Western medicine,
Yeah.
holistic, versus what I look at as the quick fix,
Yeah.
medications, or something that's going to go as
Override it.
override and at best a band-aid in some cases. Yeah, it deals with the symptom but doesn't get to the root cause.
Yeah.
And the problem in Western medicine is that those are the kinds of things that are funded, the medications,
So true, because why? It's run by, right. Well, we could get into the whole
Yeah,
political part,
yeah,
right? Well, because,
exactly. Yeah.
right, political action committees are, pharmaceutical and food industries. They give a lot of money to our government and to our politicians, and it makes it almost impossible.
So then someone like you then has to sort of make that case. And so,
Oh yeah,
so
and it's not
you're
easy.
in the community and obviously you have a business
Hmm.
and you want to make sure that parents understand what you're doing and
Hmm.
why it's important. And this is kind of why we're having this conversation in part. But then, then there's that challenge because if you go and, it's covered by insurance, then okay,
Right,
we can send Johnny to this one.
exactly.
But, if there's this extra step or challenges on that side of things, so tell me about that whole situation,
Okay,
for
so
you
it's really
from a business
interesting.
perspective.
Right. It's very interesting because, as going back to what we were talking about, as a mother, when I heard this, I knew it to be so true in my bones that I just couldn't look away and I couldn't do my job as normal after that. Um, Most of my patients are actually from out of town, way out of town.
Wow.
I would say probably 75%.
So they're traveling
They travel
an
up and down
hour,
the
2
East
hours.
Coast.
Yeah.
So I have a family that comes from Florida. I have a family that comes from Georgia. I have some families from Maine, um, Connecticut, lots of like way upstate New York. The reason why is because there's not enough of us doing this, unfortunately. That is going to change. And it's going to change for two reasons. One, because the American Dental Association, which is our governing body, is getting hip to it, which is interesting because it is a governing body full of red tape and everything. But I don't want to say the word obvious, it's just so intrinsically true that they know they have to get involved. So in 2017, I think most people listening would realize if they're an adult and they go to the dentist, they get an oral cancer screening. I mean, it's part of our purview. We have to do an oral cancer screening um, because that's in our domain. In 2017, the ADA said all dentists must do a sleep screening. Now, they also said in 2009, all dentists should be seeing kids no later than 1, but it still takes time. There's still dentists that you call and say, I want to bring my not a pediatric dentist. I want to bring my child. We don't see children till 5, which is fine. But the second sentence has to be, but your child should be seen by 1, and here's a provider that will do that. So it takes a long time to trickle down, but the ADA is on it, okay? Because a lot of this literature is coming from the medicine side, not the dentistry. Dentistry is still stuck on, which is important, but biomaterials, how we can do this, how we can make this look better, how we can make the ways we treat symptoms better
Mm.
instead of really treating the organic part.
I mean, you have dentists who have been doing their thing for
Well,
30 or
okay,
40
so that's the
years.
problem. So that's why I say
No
this
disrespect,
no,
but
no,
yeah.
right. And they're excellent at what they're doing.
Yeah.
And you have to incorporate this in a business, you have to completely change your business model. So that's why I said earlier it was sort of like a breakthrough slash breakdown. A lot of people are too old to remember Jerry Maguire, but you do remember when he
Yeah.
wrote his mission statement, and he was writing it saying, this was a breakthrough or a breakdown. That's kind of how I felt because I had to take everything I knew and basically start over. So around 4950, I restarted, almost like I left everything and had to restart again because I felt that strongly. So it is coming from the medical and dental community slowly. I mean, we're in rural areas, so it's going to be coming even more slowly.
Mm.
Um, but it's really coming from moms. Moms are recognizing this and they're reading. I mean, the first thing I did when I got pregnant was get what to expect when you're expecting. Parents are smart, moms are smart, and they really know their children. And some of them are just tired of hearing it's not that bad. Because the flip side of that is it's not that good either.
Mm.
And our kids should be thriving and sleeping and eating and learning and living the best out of these are the best years, right? And if they're kind of just slogging along and there's something that you can do other than pharmaceuticals to help them, why wouldn't you do it? But it's a different thing. So when people come to see me, we're going to enter into a growth relationship. I'm probably going to see that child from the time they're 3. We'll do a little bit more when they're 6 and 7. We'll let all their teeth come in and see if they need final alignment at 12. That's very different than going to a traditional orthodontist and saying, this is what we're going to do, year treatment, you're done. I am not taking anything away from orthodontists. Orthodontists are very, very skilled clinicians, and they know how to make teeth beautiful and perfectly straight. But it's still very much tooth focused. And the traditional age, so orthodontic screenings, you're supposed to have your first screening by 7. And then most children end up getting braces around 12-ish when you get all the teeth in. Well, by that part, you're just rearranging the furniture, like you've bought the house. If you start like
The
75%
house,
of your
the square footage of the
yeah,
house is
exactly.
still the same.
Right. You might want that really nice couch, but it's not going to fit. Okay. So the best time to treat for structure. Okay. And structure is going to give you more room for your teeth, but it's also going to give your airways more room. I'm not saying it's going to solve everything because you have to treat the structure well. You have to make sure there aren't other factors like allergies, tonsils, and there's all these things. But at the very least, you're creating optimal structures that we're supposed to have, as opposed to just waiting to rearrange the furniture. And about 75% of your jaw growth is done by the time you're 5.
Mm. So it's got to be early.
It's got to be early. And then that other jaw growth that is talked about, that prepubertal jaw growth, it's there, but it's only 5% or less.
Mm.
So, yeah, it's sort of like if you want to, how do I say this? Like if you wanted a shade tree, right? You're going to plant a sapling and you're going to guide it, right? Like with some rope or whatever to curve a certain way. You're not going to wait till it's a big tree trunk. You're going to guide it in the way it wants to be guided
Mhm.
while it's soft and pliable. And that's what we're talking about. Um, Going back to the third molars, yeah, our third molars are going to be the first ones to go with, small jaws. But what we're seeing, and I'm sure you know people who have had premolars taken out to make room for their teeth.
Mhm.
Well, to me, that's like saying, I really like this pair of shoes, but they don't fit. So I'm going to cut off 2 of my toes to make them fit.
Mm.
Okay. That's just my philosophy. And when people come to see me, like I really try to give the utmost respect to all of my peers and colleagues. My approach may not be for everybody, and that's fine, but I'm not going to change my values and the way that I believe things to be true if I don't feel it's right for the patient. And it's not an argument, it's nothing to be mad about. It's just to say, okay, I might not be a good fit for you, Dr. So and so may be, because I just can't compromise children's health anymore by ignoring certain anatomical and physiological truths
That you learn over
that
time,
you learn over time.
when that comes to light. I look at that. So, 5 is that time frame. So maybe you're with looking at a child at 3
Yep.
and 4, and so okay, hypothetical that that area
Right.
there's something going on there, maybe too small, and of course, this can impact speech,
It does.
absolutely,
Absolutely.
that sort of thing. So then what are some of the techniques that you do to address that?
Great question. I just want to go back to the speech issue thing
Sure.
because a lot of my patients are referred to me by speech pathologists because they're getting hip to it too.
Mhm.
That in order to make certain sounds, you have to put your tongue in a certain place in your palate.
Mhm.
Okay. And there's speech therapy, which is learning to compensate for making sounds. And then there's speech therapy that's saying, hold on, I'm running into a barrier because this tongue basically doesn't have enough room to hit it.
Right.
So I get so many, thankfully, collaborative partners with speech pathology where they say, okay, we've worked to the point where we can't work anymore. You need a bigger space. Come do that and then come back to me,
Right.
kind of
Yeah. I
thing.
mean, big difference
Big difference.
compensating for
Yes.
something that's not
Basically, we're learning to
correct.
compensate.
Yeah. Yeah. So,
Forward head position,
yeah.
we all have it. I mean, yes, it's sort of due to the screens and everything,
Yeah.
but putting our head forward helps us open our airway. Okay. Thrashing around in bed, like not just thrashing, but changing positions a lot in your light stages of sleep, which disrupts your deeper stages of sleep, is really to reposition your airway. Tooth grinding, we now know. I learned it was you'll grow out of it. Tooth grinding, and this comes from the medical literature, is diagnostic of an airway problem.
Okay.
Okay. So what do? We expand. We basically grow these jaws. So these bones, like going back to my sapling, are pliable. They're ready to grow, right? They're just looking for the right cues. So we use certain appliances. We use expanders, like they're expanders that actually, make things grow bigger. We can use orthopedic devices that make jaws start to grow in the right way. A lot of the feedback I hear initially is like, "Oh my gosh, that just seems like a lot." Right? Like, "Can my child handle it?" Sort of thing. So, I always say the biggest predictor of success is how parents feel, right? Like, do they understand that this is less of a tooth issue and more of a health issue? And the ones that do set their kids up for success. So, I will tell you that small children wearing appliances, for me, and it could be partly because I'm a pediatric dentist and I like working with kids and I like working with parents, and I can slow down and so can my team to meet children where they're at to get them to do these things.
Mhm.
They adapt so much better than preteens and teenagers.
Mm.
Nothing against preteen, but the older we get, the more stuck in ways we are.
Sure.
And kids at that young age really work for praise most of the time and for pleasing adults. And there's so much you can do with that. You know, if your 2 or 3 year old wants to run across the road, right, without holding your hand, and you stop them, what do? They usually turn into a pile of tears.
Mhm.
But they're learning. They're learning they can't do that.
Mhm.
If you put an appliance in, and the first day the child is like, "Oh my gosh, I can't make it." But with our support and parent support are like, "You can do this." Right? Within a day, they're fine. And I will tell you, 99 out of 100 patients, when the day that we take out the appliances, they actually may be more upset than they were when we put them in because they've gotten so used to them.
Mhm. Mhm.
So they do great. It just depends on your approach.
Yeah.
It depends on how you approach the child and how you approach the parent and sort of how you tease, that behavior compliance
Mhm.
out of them. And kids are just so much
Yeah.
easier.
Is this something that they have overnight or
Oh,
it's
they have
all
to
time?
wear it 24 hours a day.
Okay.
Yeah, because we're growing 24 hours a day.
Yeah. Yeah. Okay.
Yeah. But so that's why I'm saying it's always good when I talk to people to talk about the why before the how.
Mm.
Because if you understand the why, how we get there is more palatable, right? And to remember too that this is health focused. This is
Mhm.
quality of life focused and not teeth focused.
Yeah.
So a lot of people may give up like, "Ugh, I don't care if my teeth are perfectly straight or not." But you do care if your child has optimal airway spaces
Mhm.
and if they're sleeping well. And they're functioning well. And so many parents that come to see me, their kids are at the end of the rope, and so are they.
Mhm. Yeah.
But over time, things just start blossoming and changing in such an amazing way that the rewards that I get out of it is so much more meaningful and sort of soothing to my soul here on earth than just doing for me a filling and having them walk away. To make
Mm.
these real changes in parents' life and kids' lives is, and the fact that as a dentist, we can do that with our own two hands is really a gift. And it's amazing.
It is. And I look at that, and when the parents are having that conversation, I mean, because if they've come to you in the first place, there's already, kind of that somewhat of an understanding that
Exactly.
there's something different there, and so forth. But
And that I don't not to that's one of the reasons why I focus my practice just on this.
Mm.
So, and stop doing the restorative dentistry because it does take so much um, trust building, explaining, time that you can't really have these serious conversations with parents like in the middle of doing two fillings,
yeah, yeah,
right? I mean, we're
right.
talking about
Yeah, if
big
you're if
stuff.
you're if you're going to be authentic to what you're doing,
Yeah, right,
you
right,
can't on one hand say, okay, well, we're going to do this,
right.
innovative stuff that we know
Right,
is,
and that might not be what a parent is
yeah,
walking into expecting either,
yeah,
and it can feel overwhelming and almost overbearing,
mhm,
right? Like, if you're just bringing your child in for a cleaning, and then you don't know any of this, how did I learn this the hard way? And you say, "Your kid might get sleep apnea." They're like, "What?" Like, they're not prepared to hear it.
mhm,
Um, there are, a couple pediatric practices in this area that take excellent care of kids and do their thing. So I felt by taking myself out, there wouldn't be an access to care issue, and I could really focus on this. So, yes, when people come to see me, they have some sort of underlying reason why they're there. And that has been a game changer in terms of business because it is very hard to, although we need to more and more, the more dentists start following our guidelines and doing this, the more parents will be used to hearing these things. But if you're not primed and you just think you're getting your kid in to get a prophy and somebody just starts laying all this stuff on you, it really is overwhelming and a turnoff. So you have to kind of just dole it out as slowly or as quickly as parents are receiving it
mhm,
and plant the seed,
mhm,
right? People that come see me, the seed has been planted
yeah,
a little bit. Another question I get asked a lot is this new? No,
mhm,
it wasn't until the mid um, 20th century that orthodontists and dentistry, and medicine too, got so specialized
mhm,
that no one's talking to each other. It's like that parable of the three blind men standing around an elephant.
mhm,
One's touching the tail and saying, "Oh, it must be a this," and somebody's touching the trunk and saying, "It must be this," and no one's talking to each other. So it's great that there's so many specialists,
no
eye
one's seeing the
specialists.
whole elephant.
They're not seeing the whole picture,
Yeah,
right? So that happened very much in orthodontics. Orthodontics in the late 1800s and for the most first half of the 20th century, ENTs and orthodontists worked together, and it was growth based, and it was early, and it was functional appliances. It wasn't fixed braces. It was very much about function. Um, you can look up something called "Shut Your Mouth and Live" or something. George Catlin. This was in the, I think, late 1700s, early 1800s. He was over here with the early colonists, and he was seeing the difference between how the Indians looked and lived and how moms of babies would gently put their babies' lips together so they would breathe through their nose. Yet all these Europeans, he described these long faces, snoring, the difference in nutrition. This information is out there. It's just whenever we get a quick fix, it's always easier. So in the mid 20th century, if you look at teeth just from the tooth point of view, if you're very crowded, right? So you can either say, "I'm going to start your kid off at 3 and I might be seeing them until they're 12." Or you can say, "We see some problems are here. Let's watch and wait. Let's watch and wait. The teeth are all crowded. Let's take out some teeth and then make them look perfect. It's only going to take you a year. Slam bam, done." The problem is you're reducing oral volume and airway volume when you do that.
mhm. And then also, in that whole picture, maybe it's an organic following of the money to where that is, or maybe it's the other way around, but money drives
Money drives.
a lot of this. So therefore, an orthodontist not necessarily being involved in the early development stages and more focused on getting those braces on, which I assume is the highest margin part of orthodontics. I could be wrong.
No, it
I
is
could,
because it's
yeah.
less education. You touched on something really important. I mean, our appointments are more about education, learning, teaching the child too. Like this doesn't work unless you start educating the child to be responsible
Mhm.
for their own function. You know, treating them
But what's the reimbursement for that for an
well.
orthodontist? For and I guess that's my
Right, there
point.
isn't right,
There isn't.
right. The
Yeah.
orthodontic model, and I used to work in this model too, is that you have great team members, right, and lots of chairs surrounding you, and you're just doing mechanics. And I'm not saying it doesn't work, but yes, you can make a whole lot more money. You can see a whole lot more patients and get it done if you're doing that way, as
Mhm.
opposed to
Because the system's
it.
set up that way.
Right.
It's not.
This
It's
is a
yeah.
thinking person's game. Like you can't go into robot mode
Yeah.
because you're treating each individual
Yeah.
situation.
Yeah.
Um, so yeah, that's the model. And that's why a lot of dentists and orthodontists, I think, quite frankly, are having a hard time incorporating it into their very busy, very successful practices.
Because there aren't enough dentists to go around,
That's right.
to be honest with
Right.
you.
And then there's a few of us around the country who just are focusing on this because I really one doesn't negate the other. Okay. It's just like
Because you
it's
still need
right,
cleanings. You still
as human beings, we have a choice of the kind of care we want. And all I mean, as long as you're informed and
yeah,
then you know the decisions you can make, then make your decision.
yeah,
But you have to be informed,
yeah.
right? You have to know what's out there. And maybe it doesn't make sense to you. And that's fine. But maybe it hits something that you know as a parent, like this makes sense. And it really came to a huge head. Did you read the book by James Nestor called Breathe?
I did
Or
not. I
breath,
did not.
rather. So about 3 years ago, and anyone listening, I'd
Put in the
recommend.
description of the episode here,
Yeah,
definitely.
right. Um, James Nestor, who's an investigative reporter. He is not a dentist. He's not a physician. He's an investigative reporter, and one of the big pieces he did was about free diving, right? Divers that go really deep without a tank. So that led into breathing, and that led him into some research. And he wrote an entire book called Breath, the Lost Art, right? Breath, the Lost Art. And he did an experiment where they basically blocked his nose for a month, and he documented all the health changes.
Wow.
But throughout his whole book, he is talking to the experts, some of which are my close personal friends that I work with. You know, we kind of have made a consortium. And the whole book is basically like the end, start early.
Mm.
And that because it became um, into the public consciousness without a doctor or dentist pushing it, really started to open people's minds. And what they do when they read it is they're like, oh my God, that's me. And then they think, oh, I can help prevent some of this for my child or help them manage it better. And then where do they end up? In an office like mine.
Mhm. Okay.
Yeah.
Okay. Yeah.
And we still do cleanings, but really what we're doing is we're looking, I don't do restorative anymore. We're looking how can we help these families educate them so they don't get a cavity? And if they do, to talk about why. And it might not just be as simple as stop drinking juice, right? And so maybe you get a series of decay, but it doesn't keep happening. It doesn't keep repeating itself. So our practice philosophy is really looking at the why and not the how, to just try to help kids just grow up a little bit healthier,
Mm.
you know? And what we see in kids' faces and their oral posture with open mouth is so common that we're starting to think it's normal, but it's not normal. It's just not healthy,
Mm.
right?
Yeah.
So,
So you're in the Berkshires.
yeah,
You're born and raised here,
yes,
and that's where your practice is, and of course, that evolution, and you're right on William Street,
yes.
I believe, right?
Mhm.
And so, tell me about your family and being in the Berkshires, and apparently drawing business to the Berkshires because people are traveling
Well,
from everywhere to
yeah,
come see you.
that's right. So yeah, I was born in Boston, but I lived in the Berkshires, I think, since I was 2. And I went to PHS. I went to Berkshire Country Day for first 5 years, and then I went to Herberg, and then I went to PHS. And then, like most kids that grow up here, you're like, let's get out of this boring town, right? So I did. And I met my husband, who's also a dentist. I met him in dental school in Maryland. We lived for a couple of years in Germany, which was amazing. I call it BC, before children, because he was in the armed services. He was a dentist in the armed services. We came back to the US mainly because I wanted to do my pediatric residency. I always knew that I wanted to do that. And then I had 2 children, Jack and Libby. And in 2009, we decided to move back. And the reason why we decided to move back is that I knew it was a great place to raise kids. I knew my husband would love it, which he does. We were both sort of in a position professionally where we are either going to get into something that would keep us in Maryland or kind of start again. And, or, we were young then. And of course, even though my family never ever encouraged me to be a dentist, they didn't discourage me, but it wasn't like my predetermined fate. I took the LSAT.
Family business.
Yeah, I thought I was going to go into law school.
Oh boy.
But so I had never considered actually working with my father and uncle because I never thought I was coming back.
Mm.
But now we're deciding to come back. So, of course, it makes sense to join the family business, which I did. And it went really well until I had my breakdown / breakthrough. Right. And it was coming at a time that my father was retiring and my uncle wasn't. And I just couldn't, I just had to break free and kind of get out of what you were sort of talking about, like that setup that makes it so difficult to kind of veer off a little bit and try to do something else. So in March of 2020, I left. It was great timing.
Right in the teeth of COVID.
It was crazy.
Yeah.
It was crazy. And, I had a contract on a building that obviously we let go because, there was a time as dentists, I'm sure your sister went through this, my husband and I did in the first couple of months, we were looking at each other saying, are we ever going to work again?
Mm.
It was a very scary time.
Yeah.
And it was not a great time to start a business. And it's still been fighting uphill a little bit, but I can't imagine doing anything else. I just can't. And it's just something that I feel like, it sounds silly to say that dentistry is a calling, but I think anyone that goes into medicine or dentistry wants to help people, right? In one shape or form or another. And this way that I can help people feels really meaningful to me. So it's worth it. I can't go back. And that hasn't made it easy, but it's made it worthwhile.
Dr. Lauren Ballinger. Hey, what a wonderful conversation. I know I've learned a lot.
Oh yeah.
And I can tell you, our hope is to educate more people about this because that whole dynamic of the sort of holistic root cause approach, that is the fundamental issue in Western medicine.
Yes.
And I don't care which part of it you look at, whether it's behavioral psychology or
Even
depression, heart
yeah.
disease, you name it. Yeah. So
Well,
many levels.
interesting that heart disease, stroke, mental health, so many things have a common factor, and a lot of them are sleep and
Mm,
breathing problems.
yeah. Probably more and more will be discovered even
Yeah.
further. Yeah.
So, I mean, if you can, again, I don't think we can cure anything. Well, I think what we're trying to do is make things better and more manageable. And if you can have a longer health span before you start to need everything that thankfully we have, like, thank God we have antibiotics, right? But does a child really need to fail 7 rounds of antibiotics in a year
Mm,
before somebody looks at what is going on?
great point. That's a great point.
Right? And the other way I look at it too, I truly believe our kids are they're screened for hearing and eyes. I am telling you, they're going to be screened for this, because what if you detected that we see babies in glasses all the time, right? What would their life be like if somebody said to them, it's not that bad, let's see if they grow out of it, let's see how they do, it would significantly impact their life.
Mhm.
And this is no different, right? Like how you breathe and sleep and what it's based on, some of the things, you can't ignore that and say, let's just wait and see. Kids may grow out of it, but what was the collateral damage? Like, for instance, sorry, I know we're getting good, but snoring alone in the population of 2 to 5 year olds has been shown to cause irreparable damage, neurocognitive damage. Okay. So it's been shown that you could lose up to 10 IQ points
Mm,
for this.
it's amazing.
And somebody who's average or above average and in a great family with great support and money and tutors, 10, 10 IQ points might not make a difference. But in a family or a child that's more average or low to and doesn't have all the support, those 10 IQ points can be the difference between going to college or not, possibly. Also being labeled. These kids are labeled so early as hyperactive and disruptive, and that follows them through their entire career. You know it, and I know it. And then it's a self-fulfilling prophecy because that's all the kids hear
Mm.
is all the bad stuff, the bad stuff. But do you know how great it is, like, to talk to a kid who was going through this and really engage with them and say, a lot of this has nothing, it's not your fault, and would you like to get better? Yes. And then you have their buy-in. They don't like being the center of attention and always, trying to earn sticker charts and not get in trouble and everything. They want to be better too. So it's, again, this watchful waiting sometimes is watchful waiting for things to get worse. And it just doesn't make any sense.
Change maker.
Yeah. Yeah.
A great pleasure.
Yeah. It was fun.
Keep on fighting the good fight.
Yeah. Thanks.